Hand expressing, what do you collect into, how do you collect it, and how do you do it? So hand expressing is great from about 36 to 37 weeks of pregnancy, as long as you haven't got your placenta covering your cervix, called a placenta previa. This is a great strategy to collect your colostrum in pregnancy, freeze it and have it postnatally for in case you need it. For example, you're exhausted on day 3, you just need a break and your partner can get up and give some syringes of colostrum. Maybe your baby's on some blood sugar monitoring, for example, whatever it is. It's that emergency store of colostrum if you need it postnatally. How you collect it is up to you. You might want your partner to help you with the syringes, for example. When you get used to collecting colostrum, if you are in healthcare, for example, you get used to pulling the syringes back quite easily, but it can feel cat-candid. This is where a very clean shot glass with warm soapy water, for example, can be useful. So you can hold this underneath whilst you're doing that hand expressing. And then whatever you get in the shot glass or whatever container that you've got, you can then just syringe up afterwards, and then this can go in the freezer where you can then store it for up to 6 months. Just make sure you label date and time it. So how do you hand express? Well, firstly, get yourself really comfortable and give your breasts a really good massage all over for a minute or 2. After a warm bath or a warm shower can really help, or warm compresses also help with colostrum expressing itself. Then what you're going to do is have a C shape with your thumb and your finger, and you're going to go where the areola meets the colouring of the skin. You're going to go back and you're going to feel to where you can feel the ducts, so they're the knobbly bits, okay? So you're going to press in until you can feel your ducts and those knobbly bits. They are what you're going to just gently squeeze. And what you're going to do is just sit there for a few minutes and just do some gentle squeezing. I'm not rubbing at all, I'm just gently squeezing. And whatever you get, you can then collect in that shot glass, alternatively into the syringe. After a few minutes, you're going to move your fingers around and you're going to go the other way. So you're going to go back until you can feel the knobbly bits, and you're just going to gently squeeze. And what you're aiming for is no more than 5 to 10 minutes. To begin with, you're only going to get very small amounts, tiny drops, but the more you do it, the more you're going to get out overall. And if you do, say, a little bit in the morning, a little bit in the middle of the day, and then a little bit before bed, you can collect in the same syringe over a 24-hour period before you put it in the freezer to store. Milk and colostrum last for up to 6 hours at room temperature, and in a fridge it can last up to 3 days if you're unsure about your fridge temperature, or if it's more than 4 degrees C in your fridge at the back, or alternatively it can last for up to 8 days in a fridge at the back if it's lower than 4 degrees C. But for colostrum harvesting, the easiest thing to do is whatever you've collected in that 24-hour period is quickly label date and time and stick it in the freezer once you've got whatever you've got in there. It's a great skill and strategy to learn, and it's fantastic for if you wake up with that boob job feeling where your boobs have exploded between day 3 and day 5, to hand express to relieve the pressure for both you and also to make it easy for your baby to latch onto as well.